I am Dr. Praveen, Consultant Cardiac Anaesthetist and Intensivist, practicing here in Frontier Lifeline Cardiac Anesthesia. Anesthesia in cardiac surgeries is slightly a little bit different when compared to other surgeries, because in other surgeries only that particular system is going to get involved, but anesthesia in cardiac surgery almost all the organ systems are going to get involved, and hence it is much more different and partly difficult also in a way when compared to other surgeries. The hemodynamic disturbances and the way the cardiac surgery per se affects the entire course of the surgery and the patient's physiology is going to be totally different. So definitely anesthesia as far as cardiac surgery is more challenging and more different. Cardiac surgical patients have to be evaluated first from a cardiac point of view, like the overall functioning of the heart, completely evaluate. And another important part of the evaluation is head to toe evaluation, because we'll have to evaluate how good the other organs and other parts of the body are functioning. We need to know those baseline characteristics and we need to evaluate them completely before we put them under anesthesia. During cardiac surgery, there is a lot of hemodynamic disturbances. Like for example, in general surgery, there will be hemodynamic disturbances in general surgery as well. But the overall hemodynamic disturbances are not going to be the same when compared to cardiac surgery. There will be extremes of pressure as far as highs and lows are concerned. There will be high pressures as well as low pressures happening during the course of the surgery. And when we say cardiac surgery, it actually doesn't just limit to the operation theatre alone. It also continues to the ICU as well. So this basically it is a minute-to-minute monitoring, or to be even more precise, it is a second-to-second monitoring. So every beat is being monitored, and for that every beat, what is the corresponding pressure is being monitored, and for every minute we need to know the exact oxygen saturation. So a lot of factors have to be, or a lot of vitals have to be monitored as far as cardiac surgery is concerned. It's not like a 2020 game, it's like more of a test match where you have to monitor them for a period of 2 or maybe even 3 days. So that is as a whole, you need to monitor them more precisely and continuously. Since the advent of cardiac surgery in India, the monitoring systems have evolved over a period of time. The routine things which are monitored are the heart rate, blood pressure, and the oxygen saturation, and as well as the central venous pressure. There are also a number of other things which are also being monitored. For example, the temperature of the patient will be monitored continuously. The hourly urine output will be monitored continuously. And not for all subsets of patients, but for certain populations, we also do the neuro monitoring, where we monitor the saturation as well as the blood flow to the parts of the brain. So that is also being monitored for certain populations. And sometimes we also monitor the cardiac output, the overall blood flow to the different parts of the body. So that is also being monitored. And for these, we need to use more invasive devices. So basically, in other words, the role of a cardiac anesthetist is from the time preoperative preparation till the time of shifting from the ICU to the room or wards, the entire vitals have to be monitored. So it is like a constant monitoring. Yes, there are clinical ways of assessing a patient, whether the patient is stable or not, but these devices which have been placed at the time of induction of anesthesia help us in monitoring all these vitals continuously during the intraoperative period as well as in the postoperative period in the ICU. I think it's of paramount importance that there's a lot of communication and coordination between the surgeon and the anesthetist. So the manipulations or the surgical interventions that the surgeon is doing on the surgical field is directly going to affect the hemodynamics, the blood pressures, the heart rate, and the entire physiology of the patient to a big extent. So there has to be a constant communication. If there is something which has gone wrong on the surgical side, the surgeon definitely needs to communicate to the anesthesia team what has happened or what needs to be done, because this has happened on the surgical field. And similarly, the anesthetist also has a very important role of communicating to the surgeon if there is any pressure drop or if any drug has been given, which is drug in the sense any anesthetic drug which has been given to maintain anesthesia, which sometimes will cause some amount of hypotension or a BP fall. So all these things have to be communicated. In fact, there is a big need for constant communication between the surgeon and the anesthetist during the entire perioperative course. Cardiac anesthesia in India, I think, is like close to at least 50 years or maybe even a little bit more. So over the years, the devices and gadgets, just like in any other field, have improved tremendously. And all these things have only contributed to the better safety of the patients. And in similar ways, the devices that are used for monitoring, they have become better and more precise over the period of years. Pain management during the perioperative period is done in many ways. The traditional way is by giving IV drugs, intravenous drugs, by which the pain management is done pretty well. That has been traditionally been done for many years now. Apart from that, now there are many regional blocks and regional anesthesia techniques which have increased the patient safety as well as the pain management during cardiac anesthesia and cardiac surgery. I think has evolved over the years as well. Traditionally, there are 2 or 3 techniques as far as pain management is concerned. The most commonly employed technique is by giving drugs in the intravenous. These keep the patient pain-free during the surgery as well as in the post-operative period. The other techniques which have been developed over the years are the regional anesthesia techniques as well as regional blocks. These regional blocks, they give enhanced patient analgesia and keep the patient pain-free in the post-operative period. Overall, the patients need to be first counseled both by the surgical as well as by the anesthesia teams about how the course of this anesthesia as well as in the course in the ICU is going to be. Because as I told previously in some of the questions, it's going to be at least a 2 or a 3 day course, and what they can expect, what are the things that they might come across in the ICU, because it is going to be a totally different atmosphere both in the operation theatre as well as especially in the ICU, because in the ICU they're going to be totally awake and definitely there will be at times when there will be feeling some amount of pain. So these things have to be briefed to them in the ICU. As far as the procedural details and the risks and all those things are involved, it differs from patient to patient. Some patients, they want to know almost all aspects of the surgical details, but most of the times we come across patients and who are patient attenders who prefer not to tell too much about the risks to the patients themselves. But having said that, the risks over the years has decreased considerably.